Homeostasis refers to the concept of constancy. Despite changes in the external environment, the body maintains its internal parameters near a constant level. Claude Bernard described this stability as the internal environment, called milieu interieur. Walter Cannon later coined the term homeostasis. To maintain homeostasis, the body uses three control systems: negative feedback, positive feedback, and feed-forward control system. In a negative feedback system, the initial stimulus is reduced. The response is opposite to the stimulus. For example, during exercise, blood pressure increases. After the purpose is achieved, blood pressure decreases. A negative feedback system has 5 components: stimulus, receptor, center, effector organ or system, and response. Baroreflex is an example of negative feedback. Increase in blood pressure is the stimulus. This change is detected by baroreceptors. The control center is the medulla, where sympathetic activity decreases and parasympathetic activity increases. As a result, blood pressure decreases. The effectiveness of negative feedback is measured by gain. Baroreflex has a gain of -1. Kidneys show infinite gain in blood pressure regulation. The correction is slow, but complete. In positive feedback, the initial stimulus is amplified. It is usually under nervous system control. During action potential, sodium channels open. Sodium enters the cell, causing depolarization. Depolarization opens more sodium channels. This causes more sodium entry and further depolarization. This amplification cycle is called Hodgkin cycle. Examples of positive feedback can be remembered by Clapes: clotting, LH surge, action potential, parturition, and shock. In Ferguson reflex, the fetal head presses the cervix. Stretch receptors are activated. Signals reach the hypothalamus. Oxytocin is released from the posterior pituitary, which leads to increase in uterine contractions. More contraction causes more stretch. This continues until delivery of the fetus. Feed-forward control system is also called anticipatory control system. No stimulus is required. Examples of feed-forward control system are as below. Thinking of exercise itself increases heart rate and respiratory rate. When exposed to cold, skin temperature falls. The hypothalamus anticipates changes in core body temperature that leading to shivering. The role of cerebellum is anticipatory motor control, such as hitting brakes, seeing a dog at distance while driving. The properties of homeostasis include: dynamic equilibrium, like constancy of body parameters, is maintained under the fluctuating limits. For example, normal heart rate ranges between 60 to 100 per minute. And prioritization. It prioritizes one function over another. pH and blood pressure functions are prioritized over other functions.